Explain to everyone what lipedema is and what's going on with Audrey.
Well, lipedema is a painful fat storage disease. And lipedema is a disease where the fat is really overgrowing and expanding. It actually has a mind of its own, and you get inflammation along with that, and pain many times, and swelling, and it progressively does get worse. And the only way to actually take care of lipedema is to go in and remove the diseased fat with specialized liposuction surgery.
And Dr. Amron, is there anything that you can do in your daily life to minimize it? I know she's tried undergarments, she's tried things like that. What do you do to deal with this?
Well, you know, unfortunately, that's the whole thing. The patients can do very, very little themselves. They've carried this thing really since puberty or the teenage years when it develops, and it tends to get worse. It really affects 11% of women worldwide. But there's not a lot a patient can really do. It's not going to respond to simply weight loss or even weight loss surgery. So really, the only way to really take care of this disease is to remove that fat.
Dr. Amron, I'm sure there's a little confusion out there for people listening to this. How do you make the diagnosis? How do you differentiate from somebody who has excess fat, lipodystrophy, and somebody has this condition, lipedema?
Or even extra fluid, lymphedema. What are the defining characteristics of lipedema?
Well, those are very good questions. I mean, it has a particular look to it, lipedema. It's a clinical diagnosis. There is no blood test for it. It's a set of symptoms that go along with it, many times swelling and pain, but there's a characteristic look to lipedema. And it's a column-like look to the legs from the buttock area all the way down. If you look in even Audrey's case, you kind of see that fullness going all the way down, and many times there's a cuffing and a swelling over the ankle going all the way around where the fat has overgrown that area. And many times it is confused with lymphedema, but it's a completely separate condition.
And I think it's important for anyone watching, and Audrey, believe it or not, you're teaching a lot of folks. Look, if you lose a lot of weight, we know excess skin, that's just not gonna go away on its own. Yeah. Something like this isn't going to just go away on its own. And that's one of the reasons why you're here today. We actually have your sons and your husband here, because I know the docs have something that they would like to share with you.
So Audrey, as you might or might not know, I'm a specialist in lipedema surgery, and I've developed a unique approach to removing that diseased fat with liposuction surgery. It's a particular type of surgery, and I'm going to offer my services to remove that fat from you in a couple surgical procedures and make you not only look better but feel so much better.
And we know your insurance isn't going to cover this, so he's going to do this for you completely free of charge.
And obviously another issue you've been dealing with, you mentioned in that video how often you're having skin breakdown, and no matter what you do, it's painful, and it's something that you can't fix on your own. Dr. Minniti?
Audrey, I was really taken back when you said that you feel like a failure. I can't believe how much weight you've lost, how far you've come, and you feel like a failure. You are not a failure. You've come so far. Dr. Amron and I want to take you the rest of the way.
Thank you.
And Dr. Amron's going to be taking care of your lipedema. I'd like to take care of your excess skin.
Thank you.
You just have to promise us one thing. You're going to be a good patient.
Yes.
And that you're going to come back once all of this is done and come back fixed up with their expertise and come back happier, okay?
Thank you.
And that's not it, you know, to kind of help you with the emotional side of your body transformation, because I know this has taken an emotional toll on you. The counseling sessions with psychologist Dr. Jim Spira on Doctor on Demand are going to be completely free. Doctor on Demand provides access to doctorate-level psychologists from the comfort of your home via video consultation. So you don't even have to move, you don't even have to go anywhere. You can do this from your smartphone or your desktop computer, and, you know, we're just here to help. So what do you think about all this?
Thank you so much.
Thank you, Dr.